Yeah, so welcome everybody. My name is Małgorzata Reiter, and together with Eva Maria Noll from the Austrian Academy of Sciences, I'm really happy to welcome you to this. This actually our very first guest lecture that we decided to have within our joint academy project on transition in rare diseases. And today's talk is titled Loss in Transition, Young People in Transition from Pediatrics to Adult Care. And Eva will introduce our speaker, Dr. Colin.
Thank you so much, Małgorzata. So hello, my name is Eva Maria Noll. I'm from the Austrian Academy of Sciences, and together with Małgorzata Reiter from the Polish Academy of Sciences, we are working together on a project, and today we are very happy to have the expert for transition, the Austrian expert for the topic of transition here as our speaker. Dr. Caroline Kullen studied psychology and public health at the University of Vienna and the Medical University in Vienna. She worked for a long time with the MÖWE, that's a child protection center and she worked at the Children's Clinic of Vienna General Hospital. That's the largest hospital in Austria and also the teaching hospital. So she has plenty of experience. Since 2019, she is the head of the NGO Austrian League for Child and Adolescent Health. She published widely on the topics of chronic rare diseases and on transition. And she's the mother of 4 children. So we are very pleased to have her here today. Please, there will be the chance for asking questions after the talk. If questions come up, you can also put that into the chat while the talk is going on, and afterwards we will go to all of them. So Caroline, thank you so much for being here today. You saw the talk will be recorded and will be available afterwards, so you don't have to be too busy with making notes. You will have the chance to go again and listen to parts you didn't get in its detail at the first try. So Caroline, thank you so much. Please, the floor is all yours.
So thank you, Eva, for inviting me, and thank you for this kind introduction. Thank you, Małgorzata. I'm very pleased to be here today. And also I'm sort of excited because I don't know the community. So I really hope that my talk will be of interest for you. So don't hesitate to ask questions. And I'm very much looking forward to our discussion and Q&A session afterwards. So hopefully you can see my presentation and I will just go on. So this is just for today. My name, in fact, is Caroline Čulen. It's a Slovak name, so it's not very easy to pronounce if you don't know if you don't know the name. So I will just shortly introduce you to the NGO I'm working for and I'm the head of. I've been the head of, since you said, from 2019. And it's a network and cooperation platform. We have 120 member organizations, and most of them are widely known in Austria. But I'm sure for people from all over the place and Poland, most of the logos will not be familiar. So I just wanted to start with the very beginning of my work with transition. So the starting point was around 2013, I guess, when I worked with chronically ill young persons at the Vienna hospital, the Allgemeine Krankenhaus Wien, the pediatric section. And we estimated by then about 18 to 20% of young people in Austria are affected from a chronic condition. So this might be something like type 1 diabetes, but also allergic conditions or even mental health issues. So that's a very broad view on these chronic conditions. But most of them need to go on with the medical appointments and the medical supervision lifelong. So what we then claimed, our claim was transition from pediatric care to adult care is a success story in medicine. Because as we know, survival rates of children and adolescents have increased over the past decades. And for many of them, there's a prospect of life in adulthood. Yeah, but they face challenges such as education, jobs, they need to develop autonomy. There are some issues about sexuality, having their own family, also inclusion, like social inclusion. And for all of them, or most of them, lifelong medical and nursing care is, yeah, necessary. It's recommended and it's beneficial for them. But also what we see is there are many challenges. I like to start also with a just simple and easy definition, like transfer that simply refers to the change of the facilities from pediatric care to adult care. But transition describes this process, yeah, a planned process, which is also full of purpose, and it's we need to hand over these young people from pediatric care to adult care. And you see the Bloom definition, it's from 1993. So this is not very new. It's not recent. And since for the last 40 years, we've been struggling with transition processes. And I know from colleagues and also from the literature that's still internationally seen as a problem. We started, I just wanted to show you the work we've done. We started with patients, young females diagnosed with Turner syndrome, a genetic condition, and they face, yeah, manifold problems as they grow older. And most of them are not supervised and not cared for as the guidelines suggest. So we invited at the children's clinic, we invited former patients and asked them about their current state of medical health, but also mental health, and about the care and carers and about the doctors they see. And what we realized is that for most of them, medical follow-up was inadequate. They went to GPs, general practitioners, who were not trained for this condition, and they just faced many physical problems by then. And this was rather frustrating also for the pediatricians who used to care for these patients for 15, 18, 20 years. And then to see these women by the age of 30, 40, in a not very good physical condition, this was frustrating. So then we searched the literature, and what we found was, yeah, sort of frustrating also, because as we know, failed transition, yeah, holds major risks such as reduced quality of life and increased healthcare costs. And that's very sad for the patients, higher mortality and morbidity. But on the other hand, we had evidence that successful transition improves all of this. And the increased compliance and follow-up appointments reduced the complications and also increased life expectancy and also their quality of life. So what we did then was to a publication where we recommended care of girls and women with Turner syndrome beyond growth and hormones, because that's the very obvious problem they have. But we just stated they need more also concerning transition. So this is also, yeah, 10 years ago. And then we just concerned ourselves with all sorts of transition programs, and we validated a screening tool I will show you later. And we were looking for improvements we can actually do on a daily basis at the clinic in Vienna. So we published all of this, yeah, dealing with the healthcare transition readiness, because we decided we cannot change the systems, we cannot change adult care, but we can prepare our patients to transition better, to improve the transition process. So, but in the first place, we needed to identify the challenges for transition. So this was also one of our activities. We organized a congress dealing with transition and invited about 120 people discussing, giving talks, working in groups together on all different subjects and all different aspects of the transition process. So also we had these young women, we invited them with chronic conditions. One of them is affected by cystic fibrosis, and the other young woman is affected by hyperinsulinism. So both of them transitioned and discussed with us their transition processes. And what we saw talking to these young persons was the same aspects we could find in literature. So the main challenges is the breakdown of the long-standing relationships with pediatricians. And that's apparently a challenge all over the world. The next challenge is there are only few experts in adult medicine because of these rare conditions, and because children and adolescents with these conditions, they didn't survive some decades ago. And also for, doctors in adult medicine, it's not very, let's say, not very attractive to work with these patients, because not on a financial level, and also not concerning academia and research. So it's very hard for young people affected with rare conditions to find adequate care in adult medicine. And another challenge is that autonomy and self-care of these young people mostly is not fully developed at the age of 18, but 18 is mostly the cutoff age all over the world when young people are handed over to adult medicine. So this is very common also in Australia, in Africa, in North and South America, all over Europe. So this is a challenge we all face together. I hope you can see this and read this. I'm not sure. It's a little bit smaller, but it's just a wrap up of the challenges and failures in transition. So we know more and more chronically affected children survive into adulthood, but they face increased morbidity and mortality. However, medical parameters decline and lead to poor health if they don't transition well. We see non-compliance and we see no-shows at adult care, healthcare providers. And most of these patients report poor quality of life. So, and what we know is how adolescents typically deal with their illness. So they do not only face the challenges of their condition, but also they face puberty and adolescence. And we asked our patients about their conditions, and we also searched the literature. And what we see and what we know and what we experienced is they have insufficient knowledge of their disease most of the time. And they have no clue how their medication, their therapy really works. And they think their condition is just like annoying evil, it's unfair. They try to ignore the condition. Many of them are resistant to medication or other therapies. And they take risks, which is what young people should do, of course. It's part of their growing up, and it's it's a typical feature of adolescence. But if you suffer from a rare condition, it might be even more risky than for others. So how can we support the transition process? And we have parameters for successful healthcare transition. So we look at the outcome, individual outcome, health-related outcomes, medical parameters. We also look at the individual skills, like healthcare literacy, specific knowledge of the disease, self-management skills. We look at the social outcome. We look at biomedical markers. We look that's part of the healthcare literacy, if they know how to navigate new healthcare systems. We look at the balance between parental involvement, because we need parents, and what we know is that young persons who have parents who are involved in the management of the disease, they have better outcomes in terms of physical outcomes, but also mental health outcomes. But also they need to develop autonomy and self-care. So the systemic structures, they are a big, big challenge all over the world. But there are also guidelines and recommendations for standardized processes in the transition process. So we decided for us as the ones who support the young people, preparation is almost everything. And that's mostly what we can do. So I like this publication. You see, it's from 2013 also. And because sometimes I really favor the Anglo-American way to just boil things to the essentials. And the 4 Ps is something you can always remember. So you need people. So you need the ones who are involved, who you need people who are responsible for successful transition. You need people who are engaged. But you also need processes like standardized processes, like guidelines, ideas how to follow up research would be great. You also need paper, which doesn't mean it actually has to be paper. It also can be like digital. But you need documentation, information for the patients. You need administration or training documents. I always thought, let's go digital, which was not easy at all, not even in 2020 in Austria. But we faced the challenge that we couldn't plan our transition processes because no one knew how many of our patients should be transferred in a certain period of time because there was no documentation. So this was sometimes like a surprise. Oh, there's a young woman, a young man, he's going to be 18 or even 19 next month. We have to say goodbye. So there was no preparation at all and no discussion about the transition process. And the 4th P is the place. So we need actual rooms like time and places to discuss transition and to provide transition services. And this might be either completely analog or even digital. There are transition apps, but we need this place to discuss it and to prepare our patients. So guidelines nowadays do exist. This one is a German guideline. You can also find it in English. It's called the S3-Leitlinie Transition. And colleagues from Germany and Switzerland developed this evidence-based guideline. The validity is 2 more years, for 2 more years. The process to develop the guideline took place 2 or 3 years ago, but it was a process over 4 years. And you see like as 19 professional societies were part of the process, experts, patient representatives. So they've been working on this for 4 years, and you don't have to screen through all of these recommendations, but it's just a hint. Go and look for it, and you will find recommendations who are very helpful, I think. And there are even more guidelines from the AAP, the American Society of Pediatrics, for instance. They have guidelines for transition processes too. But I didn't want to go too deep, but I can send you the links, I can send you the references. So whoever's interested in having a deep dive into transition guidelines, please, you're welcome to ask me and I will send you more information. So what's actually happening in Austria? Well, not only in Austria, but what we try to do in Austria, because we saw all over the place and in these huge pediatric clinics in the UK, in the US, in Canada, in Australia, they have transition services. They provide transition processes. They guide or try to guide their patients from pediatric care to adult care. So what we saw is all these websites giving informations, providing also documents, information material, like people you can call and get in contact with. And that's what happened in Austria at the Vienna General Hospital only 5 years ago. So now we do have information on transition processes on the website of the clinic, but before that there was nothing at all to be found for patients. I wanted to show, maybe you're familiar with these programs or you're not, so you can also have a closer look. It's just an overview, but there are transition programs. They guide step by step with materials, with information through this process. So the Ready, Steady, Go program is quite known, but also stepstones. You see, it's always sort of a puzzle where you go from one step to another in the process of growing up. So you have like 5, 6, 7, 8 steps from just entering puberty and adolescence to the time the young person is seen as a grown-up. So there are sort of also in Germany Transitionskompetenzfragebogen, so screening tools where the young persons are screened in terms of readiness for condition. And there's a lot of going on in the terms of advocacy, like raising awareness, talking to stakeholders, to people who are in charge of social insurance, to people who work in clinics. It's also more and more part of curricula with medical students, but also with people who want to go into nursing, psychology, social workers. So it's especially now for me with my work at the NGO and MPO, which deals with growing up healthy. It's our mission to raise awareness and to point out the importance of good transition processes. So you see, we had all these congresses, symposium. There were many like little awards, and you get grants from pharmaceutical industry to conduct like pilot projects, publications, and so on and so forth, all dealing with these transition processes. More of this also with the medical societies in the rare disease field. Position papers, white papers, small articles, bigger articles. So it's really about advocacy. So what is still missing and what is going on, which is makes us look positively into the future, is that many experts and policymakers and health experts are aware of the need to transition well and of the challenges and what it means for young people if transition is not going well. We see there are strategic papers, policy papers. It's included into our national guidelines for dealing with rare diseases, rare conditions, self-help groups, but also patient advocacy groups. know about the challenge of transition and the need for transition. And we see that also doctors in the sector of treating adults with rare conditions, they are aware of these challenges in the transition phase. And we have all this, especially in the psychiatrists community, we have this adolescents clinics and transition clinics. We don't have this for physical conditions, but we have this in mental health, in the field of mental health. And we have best practice and good practice examples with conditions like type 1 diabetes or neuromuscular patients, cystic fibrosis. Also some of the oncologic conditions. There are guidelines, and most of the health carers are aware addressing transition issues early is beneficial, but we have this challenge that we don't have remuneration, so we don't have financial support for transition programs. Yeah, sometimes we get grants and little funding, but there's no standardized remuneration for transition services. But we have this one, and it's really one facility that takes care of adults who were diagnosed with an oncologic condition when they were a child. So it's especially for young survivors who transition from one of the pediatric clinics into adulthood, and they will be served upon perfect guidelines. That there's research going on. They have social workers there. They have psychological support. They have doctors who are specially trained for these conditions in adulthood. But this is only one facility in the middle of Vienna, so it's not for all of our patients, all of Austria. But it's financially supported from the Österreichische Gesundheitskasse, so this is our social insurance, and patients do not have to pay. So this is really sort of a best practice example, but yeah, it's one in all of Austria. So we have publications. I'm sure you're not able to read this, but there's a link. This is the transition guideline for the Vienna hospital. But still lacking is a overarching transition policy. So transition services in Austria and internationally seen, they are not mandatory. You don't have to provide transition services. The reimbursement is a problem, and still lacking is the involvement of patient representatives or self-help groups, which might have a major impact on helping to transition patients well. So this is still something we try to enhance, to support, to advocate that patient advocacy groups engage in transition processes. So this is mainly an overview, and I hope you can relate to some of the issues, and I'm very much looking forward to open the floor for discussion. I have more slides with deeper information, but yeah, I wasn't sure what will be of the greatest interest for you. So let's go into some sort of discussion and Q&A session. And I'm happy to answer any question you will have if I can. And I will just close the presentation for now.
Thank you so much, Caroline. It was really a wonderful talk. I think we got a pretty clear overview. Thanks also for mentioning these best practices and mentioning St. Anna Kinder Hospital. I saw we have Leo Kager, the professor of St. Anna Kinder Hospital, among our in our audience. We also have a specialist from Poland, Karolina Sledzinska. She also added some information into the chat. And before we go into the discussion, I wanted to ask the audience if you want to continue to get our invitations to our next talks, please provide your email in the chat if you not have already got our invitation via email. So I open the floor for discussion, questions, remarks. I'm sure there is a lot that might be discussable. I'm not sure if I overlook all people. Please just open your mic and say something, or raise your hand, or put your question into the chat.
Eva, may I just add one thing? So I would just encourage everyone to turn on the videos. It's like always nice to see the faces, but you don't have to, of course, but you're both welcome to do that.
Thank you to remind me on that, Małgorzata. I think we also might add, please, if you raise a question, would you be so kind to introduce yourself a little bit before you ask your questions? So, who is the first? Hello, Leo. So if nobody starts, I would simply ask Leo, do you have, can you tell us more about this best example of the survivors from St. Anna?
Yes, first of all, thank you very much for the kind invitation. And I'm Leo Kager, working at the St. Anna Children's Hospital as pediatrician. And thank you so much, Dr. Kuhlen, for this wonderful talk. It's always a pleasure listening to you. Well, the Iona took about, I'm working at St. Anna more than 30 years now. It took us 30 years from the first try to get a good transition to have the Iona established. Now, it was very important to have a partner in the adult world. And we were lucky to have Felix Keil, an oncologist, hemato-oncologist, and he was very active together with us to bring this up. So it's financed by the government of Vienna, but it's and from the ÖGK, our health insurance company, but it's not set in stone at the moment. So it's still in a first phase. But what we have learned from the mayor of Vienna, maybe they will change, but you never know in politics. So but it's really an institution now that works fantastic. And what we bring in now is the survivorship passport. You may have heard about this European project, so that our survivors have an electronic health record, but also get recommendations based on their risk profile. And this is you always it was very subjective. Some did more, some did less investigations, and now this is really standardized on a European level. And we send the data to a certain place, and then there will be made recommendations, and you have this everything electronically. And we're in the phase in establishing now. So for me personally, if I don't treat only oncology patients, but many patients with severe hematological diseases, but also in our outpatient department, we have patients with inherited effects in immunology who need transition. And we have it established now for the oncology, but the next step is also to push this in a similar way forward to the other patients here at Santa Anna. The very good thing is it's not just, and this is a big that was a big step forward. Because at Santa Anna we treat not only patients from Vienna, but also from Lower Austria, Burgenland, and in part from Upper Austria. And all patients who have been treated at Santa Anna can go to the Iona. So don't know how long this will work, but it's not just Vienna is paying for patients from Lower Austria and so on. And this is really a fantastic situation. I hope this will continue. And now I will stop, otherwise I talked much too long.
Thanks a lot, Leo, for giving us additional insights into this best practice project. I still have a question. Would you like to answer, Carolina?
Yeah, I just want to say hello to Dr. Kage, because he used to treat our daughter, and she just transitioned from St. Anna to Iona. So it's very nice to see you, Dr. Kage. All the best. And of course, Iona is a fantastic project, but it's east of Austria, and we need this all over the place. And of course, we hope it will last forever, this service. We will see. We hope for the best.
Yes.
More questions, remarks, clarification?
Or sharing experiences, maybe.
Yeah. Sharing experiences.
Can I have a question? Actually, I have two questions. Thanks, Carolina, for your great presentation. And for those who join me, Małgorzata Reiter from the Polish Academy of Sciences, co-organizer of this lecture with Eva. My first question would be about different transitions, because with Eva, we are, I think, Eva, I hope you would agree, and I think you also were of that mind, that we might not be talking about one type of a transition, just depending on the disorder. There might be different needs, challenges, and basically different transitions. So that would be something that I would like to ask you. And the second thing is about the guidelines, and namely whether you have to, or is it your experience or your co-workers' experience that some guidelines need to be somehow translated for the cultural different and local contexts, because they are not quite universal. They may be produced in the US, UK, or Australia, but for one reason or the other, they may not quite be suitable for the use in Austria or some other countries. And I was wondering if this might be the case. So it's two larger topics or questions I would like to address.
So am I the one who's supposed to answer? Okay, I will try. Okay, so I think the first question was about the cultural context. Am I right? I can hear you, Malgorzata, but
Was the second one, but it doesn't matter. Whatever
okay, so
order.
one will, because it still it sticks in my mind. So that's why I like the 4Ps, because this is very basic. So I think this is true for all transition processes and for all conditions and all over the world. We need the people, we need the places, we need the paper, and we need the process. So, but that's very basic, I agree. So, and then the next step is to look at the very different healthcare systems. So that's the one thing. We need to look at the system and how do they work and how is the funding organized and yeah, how is doctors and nurses, social workers, and so on and so forth organized, and also the curriculums. So how are people trained? So there might be huge differences. And so yes, I think we need different guidelines. I like the American guidelines. I think they're very comprehensive and I think most of the recommendations apply internationally, but still there might be, yeah, especially when it comes to the funding and to the money, there are differences. And I think the second question was concerning conditions. Yeah. Yeah, of course, we know we have people with rare conditions who live lives who are barely affected from the condition, and they live autonomously, they have jobs, they have family. And this is very different from people with conditions who or the conditions which like neuromuscular conditions, yeah, with lower life expectancy and yeah, who face challenges like they need personal assistance, they cannot live on their own. They know, yeah, by the age of 30, 35, yeah, probably I will not be alive anymore. So this is very different. That's true. So yeah, there's not one gold standard, if this was the question. But still, I think, which still applies to all of these patients, we have to talk about it. We have to think timely about what transition processes will they need? What can we provide? What kind of support will they need? Who will be the people who will provide the support, and so on and so forth. So it's work, I know, and it's time costly and it needs money, but yeah, it's worth it, I guess. So yeah, this is not a very comprehensive answer, I know, but yeah, that's all I can give you for the time being, I guess.
Thank you.
And maybe just another important point, because that's why we focus on patient advocacy groups or self-help groups, because they know what their community needs and they can advocate the needs of the community. And so we try to work together with these groups and see, okay, what do people with hemophilia need, and what do people with oncological conditions need, and so on and so forth.
So perhaps I can continue with this thought, because we had in our self-help group for people with hemoglobinopathies, that's thalassemia and sickle cell disease mostly, we had this idea of setting up a buddy system so that one adult comes and takes care of some person who is close to the transition process. Are there any experiences with this kind of budding or coupling up an old guy or some experienced older patient and a young one to introduce from a different perspective into the system? So perhaps Caroline and Leo, do you have any experience with this kind of system?
I don't. Yeah, I know there's this idea of mentoring and like a buddy system, but I don't have any experiences with it, and I don't think I read any like studies, publications, or evaluations.
Do you think that might be a way to go?
Yeah, well, I'm sorry, I'm just
overwhelmed.
lacking words because we discussed this and it wasn't very successful. I don't know why, because the older patients, they don't have experienced well-performed transition processes, so most of them have no idea how this should work. So we prefer the idea of informed and trained patient advocates more than just people who are affected themselves. But what I know is that the younger generation, like the patients who are now 25, 30 years old, they sort of grow into this role of experts, and they go and give talks on transition processes, and they share their own experiences. So maybe this is something new, which might be a good way.
Leo?
I don't have an experience either, but it's interesting.
And by the way, Caroline, I really like your visualization of a sailboat for the transition process. It's so powerful to see. It might go smooth with the right wind and calm seas, right? And yeah, I liked it very much.
Thank you. I will give this compliment. I will hand it over to our graphic person, because we discussed it and we were discussing back and forth, and then we decided on the sailboat. And so thank you, Eva.
So Eva, if I can add maybe on the mentoring, because this was also, again, maybe it might depend on the disease, but after talking to very few survivors, basically they call themselves first survivors of people with rare metabolic diseases. I have to say what Carolina also mentioned, most of them didn't have a good experience with transition, first of all. The second thing, they were kind of tired of being used and being the first all the time and being somehow used by the medical community. This is how they felt, because every time, almost everybody who came after them was like they had to explain time and again the same stuff, and some of them were just, they didn't want to have anything to do with the community. That was also my impression. So that's, again, probably depends on the group of patients, but in some groups, maybe mentoring may work, and maybe for the younger generation, what Caroline, you mentioned that those, we have more and more of those patients, but for the people who are really like single survivors, they are not so eager to mentor anyone, and their experiences were really pretty bad. So sometimes they are not even within the adult care system anymore. So that's also, this just my remark based on the interviews and talking to people.
Can I ask a question?
Sure.
I'll jump in. Hi, my name is Barishka Mohammed Rezai. You can call me Kami. I'm a PhD student under the supervision of Professor Reiter in Polish Academy of Sciences. I'm a medical doctor, but I'm doing a PhD right now in medical sociology and medical anthropology. So I had a question, which I joined a bit late. I'm sorry if I'm making you tell it again, but I wanted to ask about like specific situations, because I think you talked about cystic fibrosis in certain diseases where you need a really multidisciplinary approach, like a gastroenterologist and endocrinologist for certain types of, how does it affect transition compared to, let's say, a much milder case of, let's say, like some atrial defects?
Okay, so I can tell you what we see in Austria and what I know from literature. So just concerning cystic fibrosis, well, yeah, the patients need a very complex care, and they have, especially when they grow older, they need different specialists. But cystic fibrosis is still a very known condition. And also the guidelines are known and people know how to treat it. And it's not that, let's say, complicated for the medical experts. So what we see, the good care, adequate care is accessible for patients compared to other rare conditions or ultra rare conditions where we do not find the experts in adult care. So yeah, it's not easy to live with cystic fibrosis, as we know, but it's more likely to get adequate care in adult age. So, and people, we know life expectancy in cystic fibrosis, it just raises from year to year, and people have families, they have jobs, they live into their 60s all over the world. So that's, let's say, the situation is far better than for many other rare conditions. I hope that that's also your experiences. That's just, yeah, from my perspective and what we know from the communities also. And also the cystic fibrosis community, they are very strong. They are just fighting for their needs.
Thank you.
So, any more questions, remarks?
I have a question. So, because what I think, what is like we saw with Iona, with the facility in Austria that provides transition services or support for former patients, oncological patients. So we always have this question on funding, money. So are there any experiences in Poland how they do transition? Is it possible to just, yeah?
For that, I would probably call Carolina, who joined us, if you can and who also works at the and you mentioned that the program you've been working on. So, Carolina?
Hello.
Hello.
Hello, everyone. I apologize. This is the time when I'm coming back from my work, so I was just like joining on and off. So very nice presentation. Thank you very much for the opportunity to participate. Just sorry, so I didn't catch what was the question.
If I got it correctly, Caroline, it's about the Polish experiences with transition and funding for the transition. Was it also, and generally experiences?
Well, so I'm a pediatrician and geneticist, and actually we also struggle with the whole process of transition. We're trying to find the adequate place in the adult medicine, as I can say so. And so far, our colleague, a nurse, she was collecting the questionnaires regarding the transition readiness. So she's collating the data, and so far we don't have any proper actually process developed. We are trying to discuss the whole transition issues with our patients, and so far we don't have any proper funding for that. So we're doing what we can, us as doctors, nurses, and whole our team of the Rare Disease Center here in Gdańsk. Poland. So we're waiting also for the transition guidelines that they're going, I think, to be published pretty soon. I sent an link to the ERN Ithaca group who is taking care of this guidelines preparation. So I think it will be very nice to work together. So not to everyone is doing their own work on transition, but I think that we need to gather together to work together for the whole rare disease community. And yes.
Okay, I see. This is pretty much how it works mostly all over the place and internationally. Mm.
Exactly, but have you already developed, like in your center, Carol, the questionnaire that to tick, for example, what kind of questions to ask? Yes. Okay, so maybe at the end I will ask you to send such questionnaire. So then, is it in English or German?
There is one in English because we adapted it to German and validated it, but there is an English original version. It's also maybe I don't know if it's in Polish, but I can send you the link. So there are several screening tools, and I think they're very rewarding to use them.
And do you have a coordinator who is taking care of the process, finding the place for the adult doctors?
Well, this is we have young colleagues. Well, this is I'm talking about the General Hospital of Vienna and the pediatric clinic. And I just learned just last week that the colleagues, one of them is on maternity leave, the other one is leaving the facility, one is in the pipeline to to start in about 4 or 6 weeks. So it's still very new, but they're trying to establish a standardized process for all of the patients. It's quite a huge clinic, so.
Yeah, I think this is crucial to find the proper coordinator who will help us, to organize everything. Like we are pretty busy, and I think this coordinator, this is the person who must be in such a transition team.
Yeah,
definitely.
One of the 4 important P's. We need the people.
Agree.
So perhaps if we are just right now at the coordinator as a very important person, we didn't talk much about the nursing part. How is this part in the whole transition process in your experience, Caroline?
So Yeah, then Carolina, yeah, which one? Both of us.
Carolina and Caroline, whoever likes.
Yeah, maybe the Polish Carolina starts and then I will go on.
Okay, so well, I think such a coordinator could be a nurse. So I think we actually in our place we have some meetings together with nurses as well, you know, to share with the informations, with the decisions, what are the plans. But again, we are not. I'm not saying that we have everything perfectly organized. We're working on it. Yes, so we're talking with nurses as well. And I think that the nurse could be the coordinator as well. We have a coordinator of our rare disease center, but she's too busy right now to get involved in the transition process as well. She's helping us as well, yes, but we need such extra person as well.
Okay, and so what I want to share is that especially in the beginning when we started to search the literature internationally, most of the transition publications were published in nursing journals, so which is not very common for Austria because the nursing community is just starting to go into academia. And so this was very surprising for us, especially in the UK and in Australia and the US. The nursing community was very engaged and very involved in the transition processes. And they also developed programs, evaluated them, and were the main drivers in the transition process. In Austria, on the contrary, we were not even allowed to talk to the nurses when it came to transition. So it was sort of forbidden. We could talk to the psychologists, to the medical doctors, to the social workers, but not to the nurses because we were told they have bigger fish to fry than to being interviewed in terms of transition services. But this was 10 years ago. So what we see now is that we get invited to give talks and to train students who want to work as nurses. Like I told you, Eva, like at the FH campus, Wien or Salzburg or all over the place, or like Margaret Fürbers told us. So I think we really need nurses, and they are very connected to the patients. So I think it's a huge resource we have, and they are interested in transition processes. So I would love to see the nursing persons being more involved in transition processes. So hopefully it's going to be like this. That's what I tell them. Go into transition, make your role count, publish, and they write the bachelor and master thesis on transition topics. So we get many of these bachelor and master theses for revision. Yeah, we'll see.
I think Ellen wanted to ask a question.
Yes,
Yeah.
thank you. Thank you for a great talk, Caroline. I'm Ellen Ashfjord. I'm from the University of Agder. I work as an associate professor there. Here in Norway, probably in other countries as well, we have started to hire patient consultants in order to secure that the patient's perspectives are heard, and also they work alongside the medical team and focus, for example, specifically on transition, and they can have, for example, arrange workshops in order to with patients and healthcare personnel, and our university has helped them in developing a methodology for how to do this in a more seamless way, so that they don't have to figure out like every time how to do this process. So that's also an interesting perspective. And we also see that many of these patient consultants, they relieve healthcare personnel for some duties that in a busy schedule, there might not be the time. And also the patients like to talk to someone that has the same experience as them with transition, for example. So that was not a question, but it was rather a comment. Yeah. I don't know if anyone else has experience with this.
Thank you. That's very interesting, I find.
So what would be the background of these people?
It's different. It can be a person with HIV, for example. We worked a lot with projects for digital follow-up, for example. And then it was a patient consultant, which is hired to the outpatient clinic. And it's also part of the treatment to meet someone. So he kind of, he has a responsibility for coupling patients that he think would talk well together, have somewhat a similar background, because in Norway, many people with HIV, they can be Norwegians, but they can also be Somali people, for example, and there might be some cultural issues. We also did it in mental health. So we focus both on the transition from waiting to get into the clinic, but also what happens when you leave. And with diabetes, young adolescents with diabetes, we also focused a lot on patients' perspectives into digital follow-up. So it's more based on their wishes, for example, because for them, the transition was very difficult. So we have many different examples. Yeah, if that answered your question.
Yeah, a little bit. I was wondering what kind of training must the person have to become this middleman or middlewoman, and perhaps a second question.
There are actually a kind of formal training
Okay.
as well. It's a bit different. It's mostly the patient organizations that have them. And you have some major ones, like, for example, for breast cancer. But you also have smaller organizations, like, for example, for people with HIV. But they are somewhat similar, but it's also diagnosed based. And you apply for it as a job. So it's like in the newspaper, we are looking for people with such and such experiences. And you go to a job interview and you get a salary like everyone else working there. And you're supposed to be a part of the team. And we have worked a lot with guidelines for what the patient consultant should do, for example, at least in the early beginning of this. So
thank you so much. It goes back to Carolina's remark. We need the funding, right? That's a crucial part.
I think most of it has been done without funding, and also our university, we have used our own research time most of the time in many different projects. We also got some funding, but that is also a possibility to contact the universities and hear if someone is interested in this work, because there is quite a lot of work available, like research online. So.
Thank you. Do we have more questions or comments? We would have 10 more minutes.
Yes, I just wanted to say one thing that in our department recently we have hired a person who is called Reha Manager. It's like a manager of the rehabilitation, and she might be similar person like you were saying as a patient consultant. You were saying that she is connecting like between us doctors and nurses and between the social care. I mean, in the local. At her local place where she lives, yes, whether she needs any paperwork, for example, to get a wheelchair, or maybe she's looking for the psychologist in her local city, maybe she needs some physiotherapy. And again, it started from the breast cancer unit, so I think oncology might be maybe better prepared, maybe, or maybe has better funding. Maybe it's all again about the funding. So this onco team, they had this rehab manager first for the women, for example, who needed physiotherapy after the surgery, breast surgery, or maybe they needed a week, or maybe they needed some support at home as well because they were living on their own, for example. So we hope that this rehab manager, she will.
You muted yourself, Carolina.
Sorry, it's from the phone. I apologize. So I hope that this rehab manager, she might help us to maybe proceed with the transition process as well. She is here with us for the last 2 months, so it's something new, but we're trying, to use her resources more and more. Maybe she will help us with the transition process as well. But I think for that thing there should be a coordinator, like the separate person as well. Yes, but there are new ways, to find that not like as doctors we will do it, but maybe there will be an extra person to coordinate to make it better, smoothly, and more efficient.
Thank you. So, any more remarks, questions, concerns, ideas?
I guess we are all overwhelmed by the amount of work that's ahead of us, or just to discuss it. But it's really nice. Yeah.
So let me add to the chat that we are grateful also that Caroline agreed to have this talk and our discussion recorded. So we will have the record soon available on this link on this website. And yeah, I hope we stay in contact and yeah, follow up on. We are also in kind of a transition, Malgorzata and me, so we try to enter this field of transition from a social science perspective, from a medical anthropology perspective, and yeah, it's exciting what we might find out and what we might contribute from a social science perspective to this overall topic. So I would like to thank everybody for joining, for discussing with us this topic, and particularly Caroline Schulen for her wonderful talk and this insights from a long experience. And I hand perhaps over to Malgorzata for her final words.
Yes, so I can join to all the thanks, and thanks for showing up, and Carolina, thank you for your great presentation. As Eva mentioned, it's our very first lecture, and hopefully we'll be able to invite you to some further lectures, and let's stay in touch. And if you have any suggestions for possible speakers from different of the spectrum, not only social sciences, but also like medical sciences and nursing and anything else, we are welcome. You're welcome to share it with us. And yeah, the recording will be, Eva put the link to the chat for those who would like to listen to the presentation again. And yeah, that will be available soon. And what? I think let's just wrap it up. I don't know, Carolina, if you want to add anything else.
No, just let me thank you once again for the kind invitation and for the possibility to give this little talk. And I'm also very happy that you're researching on the topic of transition from every possible angle. I think that's very helpful and rewarding. So thank you, and I hope to stay in touch. And all the best to everyone who joined this afternoon. So hope to see you soon on screen or in real life.
Thank you very much. Okay, bye.
Thank you. Thank you. Bye-bye.
Bye.
Bye.
Thank you so much. Take care, everyone.
Bye-bye.
Bye.
Bye.